Welcome to HealthCast. I'm your host, Adam Patterson. We are joined today by Dr. Patricia Hayes, Chief Officer of Women's Health, and Dr. Amanda Johnson, Director of Women's Reproductive Health at the Department of Veterans Affairs. Doctors Hayes and Johnson have been responsible for overseeing the advancement of the VA's maternity care program during a time when the agency is dedicating greater resources and expertise towards building healthcare equity. The proportion of women enlisted within the United States Armed Forces has risen dramatically over the past 2 decades, leading to a corresponding increase in women veterans. This has created an imperative for the VA to expand its available women's healthcare services and provide a new scope of maternity care, a process that has necessitated both a change in care networks, as well as an overall cultural and organizational shift within a Veterans Health Administration that had long taken care of a near exclusively male patient base. Many of these advancements tie closely within the VA's broader reforms to its healthcare networks and abide by the agency's mission to eliminate what are common healthcare disparities across the United States as a whole. Dr. Johnson, Dr. Hayes, thank you so much for coming onto the program.
Thank you for having us.
So I want to start out with a bit of a background question, and that is, can you tell us a bit about your careers and your research interests and what first brought you to your current roles at VA?
So I'll start. I'm Patty Hayes. I'm the chief officer at VA, and I'm a psychologist by training. Early on in my career, I worked in sexual assault. I worked in a rape crisis center for a couple of years and learned a lot about post-traumatic stress disorder and people's just resilience and ability to get through incredible crises. And I then went and worked in the VA, where there were mostly men, and I worked a long time with Vietnam veterans and their post-deployment stories and was really touched by it. And I never thought my entire career was going to be in VA. I did leave for a while and come back, but I've worked in women's health in the VA since mid to late 80s. And then later in the year 2000, I came up to VA central office to the national executive level to be able to run women's health across the country. And I'd like to introduce Dr. Amanda Johnson, who is my director of women's reproductive health. Amanda.
Thank you, Patty. Yes, so I'm Amanda Johnson. I'm an obstetrician gynecologist by background. I came to VA originally as a medical student, and at that time I had not chosen obstetrics and gynecology as my field, my specialty field, but I remember very much enjoying my time in VA and really truly thinking, I wonder if I could ever come back here. I was thinking about gynecology, and I wonder if there's enough women here in VA to serve. And I went on to, beyond my residency, work both in private practice, in academics, and then I was able about 10 years ago to join VA as a gynecologist and women's health medical director, and was very impressed with the work of the Office of Women's Health. I got involved both locally and nationally in some of the work of building reproductive health services for female veterans. I have a special interest in obstetrics, also in rural health. I live in Wyoming and work in Wyoming, and there are some special issues there, and have found working with veterans profoundly gratifying and extremely important, and very much enjoy the work.
Yeah, those are both fascinating, and I can imagine incredibly informative backgrounds. And it sounds like you came to VA very much at the right time, especially in your current roles, because if my understanding, the proportion of women veterans has risen considerably over the past 2 decades in particular, which brings me to my next question, which is about what percentage of those who are using VA medical services at this point are women? And if you know off the top of your head, what proportion of, let's say, younger veterans, about maybe between 20 and 40 years old, who use VA services are now women?
Sure, I'll be happy to take that. You're absolutely right that because of the number of women in the military, the number of women veterans has tripled in the last couple of decades. And a long time ago, only 2% of the military could be women. So when I was talking about my early career, we had very few women in the VA hospital. But in the last couple of years and the last couple of decades, actually, Department of Defense has enrolled more and more women as active duty. And so right now, active duty military is around 20% female. There's a lag as they come into VA. So about 10% of our patients are female. And if you look at it's getting to be almost split. About 45% of our women are in the 20 to 40 group, and the others are mostly up then to age 45. Fewer and fewer women, therefore, in the World War II and Korean War era are still in the over age 65 group as they pass on.
Definitely. And in line with that, I'm wondering, it looks like, again, as you'd mentioned, the number of women veterans has tripled, or rather, the number of women enlisted has tripled over the past 20 years. And over that time frame, especially over, say, the past decade, where I'm guessing the numbers have risen at an especially sharp rate, how has VA worked to improve healthcare access and outcome for women veterans as this number of women veterans has risen?
We've instituted quite a detailed program to meet the gaps in care for women and to, I sometimes call, ramp up or run as fast as we can to make sure that we are meeting the needs of women and continuing to recognize the fact that more and more women are going to come into VA. One of the things we didn't say was that over the next 10 years, the increase will be, again, a similar kind of doubling of the women who come into VA. So we've needed to make sure that we have the right kind of healthcare for women. We call it women's health primary care providers. We train up women specifically to have expertise and skills in seeing women. And you think about it as, of course, we want to know that they can take care of their reproductive health, everything from pap smears to contraception. But we also want to make sure that they understand how women's reproductive health is part of life health. And so when you're talking to people about chronic conditions, hypertension, and also their mental health conditions, things like post-traumatic stress disorder can actually affect both cardiac health and maternity health. So we have to have this comprehensive approach to making sure that we understand not just women's care, but care for women who've served in the military and what are the effects of military service on women's lives. In order to do that, we've been dedicated to make sure that as much as possible, every woman has the access to a women's health primary care provider wherever she decides to enroll or use care. And so right now, every single medical center has at least 2 of these providers, and many have, some have as many as 20 of these providers. And our community-based outpatient clinics, about 91% have one of these providers, and it is our gap in care that we continue to really address to train up providers to see women.
Absolutely. It sounds like instating both a personnel but also a large-scale cultural shift was really necessary because, as you mentioned, there is a very strong correlation between patient care and mental health and physical health outcomes. And it sounds like VA has really gone the distance to work towards bringing those together, which brings me somewhat to my next question. And this is not just about VA, but across America as a whole. What are typically some of the greatest barriers to access that women face when trying to receive maternity care in particular? And what are usually some of the greatest sources of women's healthcare disparities overall?
I'm going to let Amanda take that question.
Sure. Well, I think first, when we think about sort of access or barriers to care, I think one of the first things that we have worked on and continue to work on is making sure that the veterans we serve and the veterans who are out there who are of childbearing potential are even aware that VA offers maternity care services and fairly inclusive maternity care services. So, what we offer includes both what people would think of routinely as part of prenatal and maternity care. So prenatal visits, lab work, medications, ultrasounds, all of those things, as well as labor and delivery and postpartum care. But we've also expanded that to include things like childbirth education classes, parenting education classes, lactation support, including breast pumps and nursing supplies. I think sometimes folks who use our services aren't aware that that is available. So I think that's important to be aware of. The other piece that VA has worked hard to create is something called a maternity care coordination program that really helps the veterans who use VA for maternity care to access their care. We don't have labor and delivery infrastructure. For example, we don't have neonatologists or pediatricians in our hospitals. So the veterans who we serve do get their care in hospitals in the community. So we know that they're going to continue to use VA services throughout their maternity journey, pregnancy and postpartum. And so we have specialized people in our facilities who cover every facility who do care coordination, particularly around pregnancy and postpartum. And so that includes care coordination between the pregnant person, their care team at VA, who may include, for example, mental health providers. We have a fairly significant mental health and trauma burden among the people we serve. And so we want to ensure that the veterans who are receiving maternity care continue to have access to maternity care providers who can sort of have bi-directional communication both with the veteran, the community provider, and the VA providers. The maternity care coordinators also have expertise in what's available locally in the community. So for example, lactation support groups or mother support groups, or for example, women and infant children's or WIC supplemental food programs, all of those pieces that are so important to support pregnant people, their families, and postpartum people and their families. And we put that together to really create some wraparound support services for pregnant people.
Definitely. It sounds like a lot of work has been done, especially in coordination with the community care program. And it sounds like, if I'm picking this up, that a lot of your work in providing and advancing women's healthcare and maternity healthcare has really synced with a lot of VA's broader reforms and modernization and just general healthcare expansion initiatives, which brings me to my next question, which is that VA has clearly invested considerable resources over the past decade, especially into modernizing its healthcare and its health IT systems more broadly. And I'm wondering, how are the more technical capacities, like, let's say, electronic health records modernization and data sharing, also helping improve the delivery of women's healthcare and really improving patient outcomes at VA?
We understand that it's really important that we have the electronic health record. And one of the advantages that VA has is that we share an electronic health record across our enterprise. And that means that wherever a veteran goes, that the person can access, the providers and everyone else can access their lab tests, their other results, and that we can share that also with our community providers. And that's a real benefit. Women get married, move around, other people just find reasons to travel. And it's really an important part of what VA offers, is to have an integrated health record. Another target has been that we've tried to institute some electronic tools that other health systems don't have. So for example, some years ago, we recognized that there are drugs, we call them T drugs. The long word is teratogenic drugs, but there are drugs that many people take for various conditions that can cause birth defects. And so we think it's important that when a provider is going to start prescribing this drug, that they talk to the veteran about whether they intend to build a family, whether they intend to have a pregnancy. And therefore, what we've instituted is an electronic tool that comes and clicks on when you try and order these drugs, and allows the provider to discuss the risks with the patient and their pregnancy intention, or whether they're lactating. That's one of the innovations. We have a couple of these that we've put in, and they just simply don't exist in the private sector in the way that they are automated in the VA. So we think these are some of the kinds of ways that we use our electronic system to really enhance our healthcare and try and make sure that every veteran is going to have these kind of tools to help them in their care.
That's really impressive and really innovative stuff too. Again, you'd mentioned that this is work that's not even being done in the private sector, a place in which VA is clearly a leader. And interestingly enough, VA is a leader in an area in which, it sounds like VA had traditionally not been as, focused on, considering, again, this was an overwhelmingly male patient base that, VA was providing for up until, again, very recently. And that brings me to something about the congressional support that VA has been receiving in this area, because it looks like the Protecting Moms Who Serve Act was passed with bipartisan support last November. By the look of it, it seems like it was sponsored by Senators Duckworth and Senator Snowe. And I'm wondering if this is something that's been fully laid out. How will VA be using the new funding from the Protecting Moms Who Serve Act to bolster and really continue building on this program of maternity care?
We really appreciate the ongoing work that we've had with members of the House and the Senate, the Momnibus group, who've been working on legislation, including the Protecting Moms Who Serve Act, and talking with us about the concerns as to whether there are gaps in care for pregnant women, and particularly, I think, highlighting the national issues about race and ethnicity, and the fact that women in America, there's a problem with maternal morbidity and mortality, and the problem seems to be accentuated among women of color. And so this was just another way in which our work in terms of our women veterans, our people who are pregnant, can be really tailored to the individual. We think it's really important, and I'm going to just say that we think it's really important to design our healthcare for the woman who's being served by us. And I think, Amanda, you can talk a little bit about some of the concerns about maternal morbidity and mortality and how we want to be able to approach that.
Yes, absolutely. I think one of the key benefits of the Protecting Moms Who Served Act is it really puts an emphasis on veteran maternal health. And as Dr. Hayes said, there's been an increased focus on maternal morbidity and mortality events in the US. And as Dr. Hayes mentioned, I just want to echo that we are aware that Black women are 3 times more likely to die either during pregnancy or in the postpartum period. And American Indian Alaska Native are 2 times more likely to die in the pregnancy or postpartum period. And that's thinking about women nationally. We know about the people we serve, and the veterans who use VA for the maternity benefit are more likely to be Black compared to the general population. We also know that they have other risk factors that put them at risk for poor maternal outcomes. And that includes being in older age at the time of pregnancy compared to the general population, more likely to have a mental health comorbidity, particularly PTSD, is known to have some just on its own potential effects on maternal outcomes. And then, higher risk of having comorbidities such as high blood pressure, chronic hypertension, who also puts people at risk. So I think that focus on veteran maternal health really allows us to elevate and create potential interventions for veterans of childbearing potential, which really allows us to work toward healthier pregnancy outcomes, as well as just improve the health and elevate the health of all of the veterans of childbearing potential we serve. It's really important.
Absolutely. And it really does sound like it is a very comprehensive effort that you really do need to be attentive to, as you mentioned, obviously, maternity health, but also various forms of mental health support and community health support. That it is, these things do not exist in a silo. You're really caring for the entire person. Which brings me to my next question. And you'd mentioned a bit about the community care program. And I'm curious going forward, are there any potential plans to expand or build upon this delivery of women's community care as part of the general expansion and reforms of VA's community care program?
I think it's important that we make sure first that people understand, as Dr. Johnson said, we can't do this without community partners, that we have to give good maternity care by referring women to the community for their pregnancy care. And, until they're completed with that care, which is usually 6 to 8 weeks after they've delivered. In order to do that well, we've enhanced the part that's inside VA. We already have a major contract called the Community Care Network, which VA utilizes to make sure that we are enrolling the best providers out there and vetting them and matching up our women with providers, which, by the way, the one barrier there is there still are areas of the country, particularly highly rural areas, where it's a little bit difficult, whether you're a veteran or non-veteran, to access care in the community because of the paucity of providers out there. But once we already have someone hooked up with community care, we then see that our number one issue has to be that coordination that we described. And so we have a maternity care coordinator, and they stay in touch with the veteran throughout their care in the community, including making sure that the veteran comes back to the VA, has an appointment at the VA within 12 weeks postpartum. And then the community care coordinator follows them out past that. So not only are they back in VA care, but they may be having other care issues, other care navigation, or having, the coping with a newborn. And we want to make sure that the care coordination is there for them. So we see it as a partnership with the community, and one which, we have the advantage in a sense that we have this ongoing community care network of providers to be able to work together with for our care.
Absolutely. And it really sounds like women's and maternity care is being made a very important and integral part of that. And before we wrap up, Dr. Hayes and Dr. Johnson, I just want to ask, broadly speaking, as kind of an end note, are there any things you really want our audience to know about VA's maternity care program, whether in the availability of services or where you plan to go from here?
We have some initiatives we're launching, and we see it as we wanting every pregnancy to be a planned pregnancy. And we want every pregnancy to be a healthy planned pregnancy. And so we're actually looking at the entire continuum from what's called preconception planning. Does someone intend to build their family? And we actually think this is really an important conversation to have with men. We sort of focus sometimes too much in this world in healthcare that women are about pregnancy when it takes two to tango usually. And besides which, I think we sort of discount the emotional investment, the discussions, and the interest that men also have in family building. And so we need to be talking to our veterans, male and female, about what is their pregnancy intention. That's the beginning. And I think that we want to then, at that point in time, help them start planning. So we talked about what's known as the social determinants of health. Are they having any problems with housing, hunger, food insecurity, financial issues, job issues? Because one of the other advantages of VA is that we have these kind of connections within even primary care to help people with these kinds of life challenges. And you can't really have health unless you have these things in place, the whole person health. And we also have a whole health program, which you've probably been learning about, so that we can offer things that accentuate health, yoga, acupuncture, various kinds of therapies and hobbies. We offer sports clinics, and I was watching a video yesterday about kayaking. You don't go to some of the other health insurance companies and be able to access the kinds of things that are going to look at you as a whole person and accentuate your health.
I would just add, I think you're exactly right, Patty, and you hit the nail on the head. We're really trying to think about the population of veterans of childbearing potential, including, men in the discussion, thinking about if pregnancy is on a person's list of things they want to accomplish in their life, or family building, that we're recognizing the importance of the time period before pregnancy, maybe between pregnancies and beyond pregnancy, and really leveraging the ability that we have within our large integrated healthcare system to impact the health of the people we serve, not just during pregnancy, but before, between pregnancies, and then after pregnancy, really recognizing that if someone has, for example, preeclampsia during pregnancy, that has a potential, impact on their future cardiovascular risk. Same thing with gestational diabetes. Same thing with postpartum depression, for example, or postpartum anxiety. So really want to make sure that we're thinking about the whole person and across the continuum, across the lifespan. And I think we're lucky to be able to do that in the healthcare system that we have. And I guess the other thing I would want to say is, we're here to serve you. We want to serve you, and that's really the bottom line of what our goal is.
Absolutely. That is something I've always found really impressive about VA, is this look towards caring for, the person in their entirety, as well as, of course, as Dr. Hayes mentioned, the focus on really bolstering community support as something that really goes into improving outcomes and patient well-being. All really, really impressive work. Again, Dr. Johnson and Dr. Hayes, thank you so much for coming onto the program. It was a pleasure to have you.
Thank you for having us. We are always very happy to get an opportunity to talk to veterans about how we can serve you as a veteran and in the best health that we can.
Absolutely.
HealthCast, along with GovCast and Cybercast, is a production of GovCIO Media and Research. For more podcasts and to check out the other shows, head to govciomedia.com. Watch out for new episodes released every Tuesday and Wednesday across our shows. You can follow all of them in your favorite podcast platform, and if you like what you heard, make sure to let us know by leaving a review. And if you have any topics you think we should look into, contact us at newsletter@gcio.com.